Name is Callie Banks, and I am doing my presentation on preventing homelessness. Our course is English 101, and my professor is Gina Warren. So I wanted to start off by talking about what leads to being homeless. What is the causes of homelessness? Um, Homelessness is a growing crisis in America and is set to worsen in the next decade due to systematic factors and economic factors like job market, health and healthcare systems, housing costs, victimization, inequality within our society. Um, but I think expanding services could really allow us to tackle down the rise in homeless individuals. So systematic failings was one of the main reasons that I stated. In my research progress, there was a study done in 2018 by the British Journal of Social Work that all included information directly to systematic failings as the main factor due to becoming homeless, and to maintain that lifestyle. And all of the individuals in the studies suffer discrimination and inequality in our society, um, whether it was trying to enter shelters or going to other service providers. They felt discriminated and dehumanized by a lot of the workers. Um, Job loss and the inability to secure employment were cited as reasons for first time homelessness. Um, and like I said, they felt disrespected by shelter workers and other service providers, which I will get into later on. Economic factors like healthcare, criminal history, and substance abuse are more of the leading causes to becoming homeless. Um, and also in my research progress, there was an article done by Cara Tangaro, and she stated that individuals struggle to receive healthcare and have been in and out of healthcare um, systems and court systems or have suffered from domestic violence. Economic factors play a big role for these homeless individuals. Having a criminal record can cause homeless individuals and their families from obtaining public benefits. And employers also usually screen for criminal background and criminal history. Healthcare is very hard to manage with criminal history, low income, and lack of employment to pay for insurance and medical bills. Um, Tangaro stated that employment assistance, homeless engagement and response teams, mobile outreach teams, and healthcare outreach programs is what has been a big role in tackling the population of homelessness in Utah. Creating programs like these, I think, will allow us to knock down the rise in this population. Um, and these programs, like employment assistance programs, help individuals with searching for jobs and different opportunities. They help with preparing resumes and lining up interviews. Homeless engagement and response teams, they have accumulated over $15 million to support homeless services and while keeping the community environment spaces clean for these individuals. They also fund units of permanent housing, and mobile outreach teams travel to areas with high population of homeless, like providing clothing and hygiene, um, and they offer pathways to other services and permanent housing. Healthcare outreach programs offer medical care to those who might not look for it, offering mental health services and addiction counseling. Um, I want to talk about the cycle of homelessness and kind of substance abuse. And it's pretty simple, but it's a cycle that's hard and almost impossible to get out of. Homeless individuals have either experienced past trauma from childhood, mental issues, or disabilities that they have not yet been recognized or even treated. In an article called Transitions Through Homelessness, Substance Abuse, and the Effect of Material Marginalization and Psychological Trauma by Drugs, Education, Prevention, and Policy, in the article, the authors explain what the cycle is kind of like and what allows it to continue. It's almost an impossible cycle to get out of, like I said. And there's not enough services or other individuals in the world that are willing to help individuals get out of this cycle. We discriminate them and make them feel unequal. And that's not what we need to be doing to tackle this problem in America. um, So yeah, the cycle is hard to get out of, and programs have to be efficient in order for individuals to escape it. We also have to be efficient in stopping these issues from occurring in the first place. All individual, all individuals caught in the cycle need our help to make them feel equalized and really be able to support them. That's what we need to do as individuals. Shelters and helping programs. Shelters and helping programs are good and bad. There have been many reports on them. But shelters didn't start to increase in America until 2009, when the American Recovery and Reinvestment Act was established. The decrease in the overall homeless veterans um, started in 1987 when Congress passed the landmark Stuart B. McKinley Homeless Act number 2. The act established healthcare for homeless veterans. And I wanted to put that out there because I think if we look at what they're doing, we could provide these for other individuals who haven't been in the military and stuff like that. Um, and there are programs that are efficient in tackling this problem. We have seen the veteran homeless population decrease over time. Um, and like I said, there's been good and bad reports of trying to enter shelters, but there's also risks to being allowed to stay in them. In an article called "Efficient Targeting of Homeless Prevention Services and Families," done in 2013 by the American Journal of Public Health, they followed a bunch of families who were applying for community-based services. And they stated that there were several variables to being allowed to stay in a shelter. Um, and there's risk entry, like if you're young or old, that determines on if you can stay in the shelter or not. If you're pregnant or have a child aged younger than 2 years old, if you've had frequent moves in the past year, there's so many different risks, but I think that they should be easier to enter. Knowing what services and programs certain individuals need, then the sooner I feel like we could help them. And that there are other routines and alternative ideas that we could provide for individuals entering shelters. So, some of the ideas for homeless individuals that so there's always more to be done with preventing homelessness. But I think the idea with permanent housing is that stable housing is the first crucial step before addressing other issues like employment or addiction. But once housed, we can offer services such as mental health care, substance abuse treatments, job training, and financial counseling to help stabilize these individuals' lives. Um, Primitive preventive measures and creating services that address the root causes of homelessness, such as poverty, domestic violence, and lack of affordable health care, could help prevent the um, individuals to becoming homeless in the first place. Community-based solutions could really allow homeless individuals to feel valued and supported by their environment. And the conclusion is steps and actions that we could take. Becoming aware of the public health crisis first could help increase everybody around us to know what is going on in America, and could help everybody realize that now is the time to do something. Getting policymakers, researchers, and communities and government officials involved could help create effective measures to go into place for the individual suffering. Finding the root of the problem and creating the effective services for the individual's specific need of the problem, and making it more effective to enter shelters, making it more possible, and maybe providing other resources if not possible to allow these people to enter the shelters. Getting communities involved, like I said, and supporting these individuals um, after completing programs and services could help keep them out of that cycle. And a study done by the American Journal of Public Health also says that helping individuals who exit homelessness remain stably housed and avoid repeated episodes of homelessness should be an important component of any strategic approach to end homelessness. So I think we need to look at the root of the problem and then figure out what services we can provide for each individual. And that's why I decided to do this project, because I think it is important for us to start breaking down this problem before it turns into something worse than it already is.